I'm from Newmarket, Alabama, and I went to a public school called Buckhorn. There was abstinence education, so there was no sex ed at all. I was told that if I had sex before marriage, you are a cup of water, and whenever you have sex with a boy, he spits in it. And who else would want to drink that cup of water?
So I'm from Lowndes County, a small rural town in the Black Belt. My first exposure to sexual health was a sexual health class. At the beginning, we signed these virginity pledges, and then we just started doing homework.
Everything I knew about sex, I learned from the internet, the back of the bus, and watching trash TV.
In Alabama, schools are not required to provide sexual health education, and if they do teach it, the state code requires a focus on abstinence.
We need sex education in schools because children, regardless of what they do, they need to have the education necessary to be able to make the decisions that's going to impact their lives.
That is the role of a school. A school is supposed to educate and prepare kids, and I do think they deserve to be given as much information as possible to make the right decisions for themselves.
28 to 28. Yeah.
I wish that more young people understood what an STI is and how it affects the body and how exactly it's spread.
Alabama has high rates of sexually transmitted infections, or STIs. One STI, the human papillomavirus, or HPV, can lead to several types of cancer, including cervical cancer. Alabama has one of the highest rates of cervical cancer deaths in the U.S., and Black women there are nearly twice as likely to die from the disease as white women. Cervical cancer is highly preventable. The HPV vaccine is an effective cancer prevention tool and protects against most of the strains of HPV that can lead to cancer. Yet in Alabama, vaccination rates are low. Without access to information, young people lack the knowledge to decrease the risk of cervical cancer and safeguard their health.
I feel like a lot of people see the HPV vaccine as something that's going to make girls promiscuous, so they kind of shun away from that. I know sometimes when I do outreach events and we talk about HPV vaccinations, and then girls they're really confused, what is that?
Vaccines are good. They help prevent disease. In this case, it can help prevent cancer. So we need to market that on a level to parents and children within the school community, within churches.
I'm so big on prevention. If we can teach people how to prevent, if we can teach you to get the HPV vaccination, if we can teach you to get those PAPs on time, maybe I can prevent you from getting cancer.